Hi, everybody. John DiDio, Get Up and Go Fitness Training. I'm here with Kevin Baldeo, our physical therapist. And today we're going to talk about some golfer's elbow stuff, correct?
Golfer's elbow.
Golfer's elbow. All right, you're on. Talk to me.
Also known as medial epicondylitis or pitcher's elbow. So it affects the inner part of your elbow, the medial side, where all your flexor forearm muscles attach to with this big, long, common tendon that attaches to your humerus, this ball on the inside of your elbow. Oftentimes, patient would have pain with pronating, so rotating their arm inwards. There's a big muscle that attaches there. Actually, it's not too big. It's called a small muscle, or pronator teres. You have some pain with rotating your arm inwards. You can also have some pain with bending your elbow up. And it's basically with wrist flexion, bringing your wrist up like this, because you're contracting all these muscles that attach to the inside part of the arm. When you hear an itis, it usually means inflammation. In this case, it's not really due to inflammation, so you might take an anti-inflammatory, stuff like that. It might not really help, so don't get confused with the diagnosis. There's a lot of this stuff in medicine which is confusing, so it's called epicondylitis, inflammation of the epicondyle. It's more of a tendinosis, which is a tearing of the tendon. These micro tears happen oftentimes due to repetitive movements in females, and strong forceful movements in males. And even though it happens in golf, it happens for pitchers, it's not very common with sports. It happens more often with work-related stuff.
Oh, wow. I didn't know that.
So medial epicondylitis, or golfer's elbow, pitcher's elbow, is not nearly as common as the more common lateral epicondylitis, tennis elbow. So some things we have to distinguish is if there's a nerve entrapment, this ulnar nerve, that funny bone when you hit that inner part of your elbow, you have to distinguish if that's causing your symptoms. If the UCL, your ulnar collateral ligament, could be strained, that could cause some pain in the area. So there's other things we have to figure out if it's causing, if it's the correct diagnosis. So once we get the correct diagnosis down, then we can get into treating it.
Half of it has to do with the correct diagnosis,
Yeah.
obviously, because some people will have it and won't know they have it.
Yeah.
Or it could be they'll think they have something else and it doesn't equate, and then you're obviously treating the wrong thing. So
Exactly, and a common thing with golf is, and when you have these symptoms, that will happen with the backhand with your swing. So that backhand, when you're going into that swing, you're going to have some pain in that inner part of the elbow.
I had it. I had golfer's elbow, and it was the strangest thing. I had it for probably 2 full seasons, and I had to wear a brace. Remember the brace that had the compression there?
Yeah.
And it did help. I could at least get through my game, and out of nowhere, honest to God, I did some active and passive stretches for it for honestly 2 years, and out of nowhere it went away, which is, you don't hear that a lot.
Yeah.
I just was lucky, I guess.
Yeah.
But it went away.
So that's a good thing about it, is that with the correct exercises, it could be fairly treatable to an extent on your own. It depends on the extent of the injury. But you're just treating the symptoms of the injury. We're not necessarily addressing the biomechanical factors that likely cause in the first place, right? So if you're not getting enough rotation, you're over rotating in your elbow with your swing, and then that's causing some of your micro tears that are happening along that tendon. So just because you're treating the symptoms and reducing the pain that you have doesn't necessarily mean you're treating the causes that made it happen in the first place. So that's one of the tricky things that's my job to figure out.
Right, because then it can keep coming back. Or you could never get rid of it.
Then it could keep coming back. I mean, one of the good things, like John was talking about, was that air cast type of splint that you can put. Basically, all that's doing is putting pressure on a new origin point of where all the tendons attach to. So it's pulling from a new point as opposed to the point on the ball of the elbow. So it's not yanking on that tendon as much. It's yanking from a new spot, and then that therefore will have a reduction in a lot of your symptoms. That can help. First and foremost, I recommend just, and it stinks, but decreasing activity to a certain amount. You can ice it and all that. It's a short-term relief for pain. It's not necessarily addressing the full extent of the issue. when the collagen fibers break down, when those micro tears happen, scar tissue forms up, and then this tightness and stiffness could happen, and then you're going to be limited with your motion, and it's going to be painful. There's some, there's debate going on with whether or not we're actually breaking down scar tissue. Scar tissue is a pretty solid thing to really break down with your fingers. To an extent, you can address the tissues that attach to that common tendon that's being torn, and that's one of the first things I would recommend. You can do this on your own. If you just work on gently massaging left and right along the long forearm flexor muscles here, if you go left and right, kind of loosen it up, 3 to 5 minutes or so, might feel a little tender or uncomfortable when you get closer to the inner part of your elbow. Do that for a couple minutes, loosen up, and then I recommend reinforcing it with stretching afterwards. Everything should be pain-free. I don't recommend doing anything with pain. So once you loosen that up, things are feeling pretty good. Then you can work into this elbow stretch right here for the forearm flexors. You want to pull from the hand, keep the elbow straight. I recommend 30 seconds, 3 times, at least twice a day. Again, not into pain. You don't want any pain. Stretching can act like your body's natural pain reliever, so if you do that, it could help reduce your pain if you're doing it correctly. If that's hurting too much, just keep your elbow bent and work at the wrist, so it's pulling a little bit more of the wrist, and then you can work with your elbow straight, and then just, work on wrist flexion and extension, and rotating inwards and outwards, and then also rotating your arm in pronation and supination. Just getting your wrist moving in all these directions to loosen up the muscles in the forearm. So that's first and foremost. So once you can do that, also work on the extensor forearms.
Yeah.
Stretch that out.
That was a big one for me.
Yeah.
That, I think, is what provided the relief for me. And I tried them all. Again, you find out kind of, again, like anything else, you find out what works for you, and then you stick with it.
Yeah, and these are generalities, and that's the hard part.
Sure.
But once that's done, one of the best things for common, tendinous injuries is eccentric exercises. So I was showing you this. We were doing this for John's, I think, your elbow. You're having some trouble with elbow flexion or your bicep, and then
my biceps brachioradialis.
Yep, the brachioradialis. So basically, for this one, I'm going to grab a heavy enough dumbbell that you can handle. Okay, you're going to use your other hand to raise up the dumbbell. Okay, my right hand, let's say this is an injured hand, is not doing any of the work. My left hand's doing all the work to lift it, and then you're slowly going to lower back down.
Okay.
So that controlled lowering and lengthening of the muscle with the resistance, eccentric strengthening for the tendon is good for tendinous injuries. So strengthen the tendon, help reduce pain. So raise up with the other hand and slowly lower down. So you want a heavy enough weight that you can, this is 3 pounds. So
Sure.
Ideally, you'd probably be using something 5 pounds, 10 pounds, depending how strong you are. And raise up with the other hand and then slowly lower. And that's probably one of the best exercises you can do.
So, you see by your explanations of this, there's a lot to this. And people just don't get that. Oh, I have a pain in my elbow. And then they want to keep playing or keep going and re-aggravating and aggravating further, and the pain gets worse. It's a pretty involved thing. You have to get it diagnosed properly by the proper person. And it's not a trainer. It's not. I don't assess injury. And I don't work on it until I talk to Kevin, who tells me what to do, reports to me on how to work with things. That's why the team is so important. It's the same as with the golf pro. I'm not going to give you drills on golf because that's not my expertise. That's his expertise.
Yeah.
So again, that explanation right there, most people are like, huh? What did he just say? Because it's his job. You should say that. This is your job. He assesses and then helps and fixes you. That's why he's so important. You're very important.
Yeah, trying to be.
But, anything else? We could go on this all day. I don't want to get crazy on it, but
there's a lot of other things that's probably one of the better things I recommend.
But again, I would say the most important thing to get out of this is to use the proper professional to get it done correctly.
Exactly.
Because you have no idea what you're doing. You just can't do this by yourself.
And again, that's only treating, the exact injury and your symptoms that's going on, but it's not necessarily addressing what's causing it in the first place, and that depends on each patient that comes in. It'll be a different story. So it could be different things for different people. So that's our job to figure out what exactly is causing that in the first place.
Yeah. Awesome. Great.
Cool.
There's your golfer's elbow info. We'll be back at you with some more, hopefully treatable or identifiable, if that's a word, injuries and on how to fix them. Awesome. Thanks, Kevin. Cool.
No problem.